Hi, my name is Bethany Foster, and I'm a student massage therapist. And right here on the table we have Austin, and Austin is presenting with early signs of Bell palsy. He went to the doctor, and the doctor believes that he indeed is experiencing early signs of Bell palsy. He's having some problems blinking his left eye, and he's having drooping on the left side of his face. He's also experiencing headaches, and the headaches are interfering with his ability to concentrate in school, and he's also having issues with the headaches while he's looking in the mirror. So for today's treatment, specifically for the Bell palsy, I will be doing light techniques just around the area of his face that is affected, and this is just to stimulate the area and help the muscle regain its function. Also, to address the headaches, I will be reducing tension in his head, neck, and shoulder area, reducing trigger points that could be contributing to his headaches, and overall helping the muscle to regain its natural state. So I'm gonna get started, and the techniques that I'm going to be using are introductory techniques. It's going to be static contact. This is just to get Austin used to my touch. Then I'm going to move along into into intermediate techniques, and that's going to be where I'm doing my effleurage to help with circulation. And then I'm going to move along into petrissage and do some seam heating, some muscle squeeze, and some broad contact kneading. And then to get deep and more specific to address the tension and the trigger points, I will be doing muscle stripping, specific compression. I will also be doing some PNF techniques to help reset the spindles after I do that deep work, and I'll also be doing some passive stretching and checking in on his level of comfort and everything, just making sure that the pressure and everything is okay for him. So we're going to get right into it. If you have any questions, Austin, or concerns, you can just ask me at any time and let me know. Do I have consent for treatment?
Yep. Yes, please.
My hands are a bit cold. Just going to be starting with some static. Starting with static contact. Okay, now I'm just going to start with some effleurage. Just get the tissues warmed up. Okay, I'm just going to move along in some kneading. Muscle squeeze. Okay, and I'm just going to move along up to his face. Just going to do some gentle kneading. Are you okay, Austin?
Yep.
Some gentle kneading to the area to stimulate the muscles. And this is the affected side where he's feeling the symptoms for Bell palsy. Okay, now I'm just going to move along into his neck and shoulders, reduce some of the tension that could be causing his headaches that he's experiencing.
Yeah, so you did our videos and then I treated her for about 15 minutes and she was like, yeah, I thought she fantastic. And then all the paperwork's done. Okay.
Okay, now I'm just going to move along and do some muscle stripping. Okay, Austin, just let me know when you start to feel some pain.
You're right
Some
there.
pain right here. Okay, and on a scale of 0 to 10, 0 being the worst pain you've ever felt in your life, 10 being the worst pain you ever felt in your life, and 0 being nothing, where would you say this pain ranges from?
Like a 5 right now.
A 5, okay. I'm just going to hold this at some specific compression and just let me know when this pain starts to decrease.
It's going down.
Okay. Let's go back in. There.
Yep.
What is it at right now?
It's like a 3.
3. Okay. Just hold that for a little bit longer.
It's good.
Okay, perfect. Okay, and then I would stretch out the area. I would also apply some heat to bring that circulation to this area. And I'm just going to do a passive stretch here. Do you feel the stretch, Austin?
Yep.
Okay, I'm going to hold that for 30 seconds. Okay, you can also do some PNF technique here, and this is to reset the spindle fibers. So I would then have Austin contract into my hand. 1, 2, 3, 4, 5, and relax. And then I would then take his head beyond that. You okay?
Yep.
And then you would then hold that. Okay, you could also do some tractioning to help loosen up the joints. You could also do some rhythmical lobes just to loosen up the area, loosen up the muscles. Okay, and that was the treatment for Bell palsy and headaches. For home care, I would instruct Austin to practice his facial expressions in a mirror, but he is having difficulties looking in the mirror. It does aggravate his headache, so I would suggest him to use his computer or his tablet or his phone, something that can show him his reflection, and practice his facial expressions doing that. And that will help, the muscles remember what they're supposed to do, and then before you know it, he'll be on his way to recovery. And we'll also teach Austin how to do some upper trap stretches to stretch out his upper traps, and to do that twice a day, 30-second holds.